So I'm right up against the wall here for our finish share for today with a lot of barbell work that we've had. It's pretty heavily reliant on the posterior chain, especially the lower back. Okay, one of our themes this month is lower lumbar health recovery. Okay, this is the one that I use for your hip capsule or the hip region that ties into the glute and the lower back. Something that we can do from the wall, but this is going to be a hip capsule stretch. Okay, you do one side at a time. If you've never done this before, it might be a little bit overwhelming for some athletes to tolerate, so kind of tread carefully and work with your athletes as best as you can. But the targeted area is right here. You're going to feel a stretch and a lengthening of the tissue and the muscle into your butt. Okay, but we're going to start up against the wall. Right, I'll show you a side that works better for your visual. Now, as close as you can get your butt to the wall, but you're going to find out how close the athletes can actually get, right? But I'm going to start with stretching out my left side, and in order to do that, I'm going to take my left leg, I'm going to cross that heel straight in front of my knee, okay? And then what I'm kind of looking at is back here, and there's a lot of space between my butt and the floor rather, and I want to try to pull my butt down while keeping this heel in the same place, and then I can take my hand, I look at my knee, and I can apply a little bit of pressure trying to stay in the same place. So you're going to feel an overwhelming stretch here. If it's too much, push away from the wall a little bit. That'll give you a little bit of relief, and then you can come back to pushing down your knee, stretching the high glute to hip capsule area, working back and forth between aggressive bouts and then relax. Okay, about a minute on that side, and we can do the same thing on the other side. Foot is in front of the knee. I have my right hand to push on my right knee, and I should feel a stretch in my right hip capsule, okay? Trying to attack those areas a little more, starting one side at a time. I would do 1 minute left, 1 minute right, 1 minute left, 1 minute right, and then call it good for the day as far as that goes. That should give you guys a little bit of relief on some of those areas, and if you add that to your routine a little bit more often, hopefully we'll stray away from that kind of hot back syndrome that some athletes experience, okay?